ठीक है, मैं अभी क्लास कर रहा हूँ, बाद में ले लो, ठीक है। क्लास खत्म होता है। हेलो, good morning to everyone.
Morning, sir.
Good morning, sir.
Morning. See, today we are going to start the first unit in that first chapter, mental health and mental illness. Okay, so we will wait for 2 minutes. Let them come, everybody. Okay. Before that, so we have studied all terminologies, right? Now we will see in which chapter what are the terminologies will come. Okay. So in that first chapter, contains mental health, mental illness, warning signs of mental illness, characteristics of mentally healthy individual or characteristics of mentally healthy person, difference between mental health and mental illness, definition of terms, misconceptions related to mental illness, and principles of mental health nursing, review of defense mechanism. Defense mechanism, also we call it as mental mechanisms, and mental health team. Here we are going to see about the what is mental health team and over the participants in the mental health team. Okay, so some terminologies or definitions we'll see before starting to our topic. First is mental health. So what is mental health? Already we have seen since from T4 classes we are seeing what is mental health. So mental health, it is a state of between the balance between the individual and the surrounding world, a state of harmony between oneself and others, a coexistence between the realities of the self and that of other people and the environment. So what is mental health? Mental health, it is a state of balance between the individual and the surrounding world. Simply we have to tell it is a balance between the individual and the surrounding world. Surrounding world, it contains for example environment, okay, our neighbors, okay. So this and all comes under the surroundings. So it is nothing but a state of balance between the individual and the surrounding world, a state of harmony between oneself and others, and a coexistence between the realities of the self and that of other people and the environment. Okay, this is the mental health. According to the WHO, the mental health, it is a state of well-being in which the individual realizes his or her own abilities can cope with the normal stresses of life can productively and opportunity fruitfully, and is able to make a contribution to his or her community. Here, according to the WHO, mental health as a state of well-being in which the individual realizes his or her own abilities. Here, they are going to realize their own abilities individually, can cope with the normal stress of life. They are able to perform their cope stress levels in the normal life. Then they can work properly, productively, and fruitfully. They can do their own works and is able to make a contribution to his or her community. So while they are doing their own work without any mistakes, so they are going to contribute their ability to make contribution to his or her community. Okay, this is the mental health by WHO. Next, we'll see what is the meaning of mental illness. The term mental illness, it is actually encompasses numerous psychiatric disorders, and just like illness that affect other parts of the body, they can vary in diversity. Sorry, they can vary in the severity. Here, the term mental illness actually it encompasses numerous psychiatric disorders. We are usually will use for so many psychiatric disorders for this term. Illness we will use for so many psychiatric disorders, and just like illness that affect other parts of the body, they can vary in the severity. What you have taken in the terminologies mental illness, just open your terminology and see what is mental illness.
Psychiatric disorder is behavioral or mental pattern that causes significant distress or the impairment of personal functioning.
So illness means psychiatric disorder. So good man. Next, we'll see what is psychiatric nursing. Psychiatric nursing, it is the branch of nursing concerned with the prevention, care, and cure of mental disorders and their sequels. See here, we will see what is psychiatric nursing. Psychiatric nursing, it is the branch of nursing concerned with the prevention, care, and cure of mental disorders and their sequels. Here we are going to treat the psychiatric patients, like we are going to prevent the psychiatric disorders, prevention, care, and cure of mental disorders and their sequel. So psychiatric nursing is a branch of nursing, deals with the concerned with the prevention, care, and cure of mental disorders and their sequels. Okay, this is the psychiatric nursing, meaning for psychiatric nursing. And next, mental mechanism. Here, what is mental mechanism? Mental mechanisms are psychological strategies brought into play by various entities to cope with reality and to maintain self-image. See, mental mechanisms, already I told, mental mechanisms also we call it as defense mechanisms. Mental mechanisms are psychological strategies, psychological strength, psychological strategies brought into the play by various entities to cope with reality and to maintain self-image. Here we are going to check the psychological strategies while using some entitle, while play by various entitles to cope with reality and maintain self-image. Okay, here we are going to see the realities. Next is psychiatrist. Who is psychiatrist?
Is the physician who will treat for the mental person or mental patient.
To treat the
mental person or mental ill, the person who is suffering from the mental illness. To give them the treatment, he is called physician or a psychiatrist.
Okay. So here, psychiatrist, according to the American Psychiatric Association, a psychiatric is a physician who specializes in the diagnosis, treatment, and prevention of mental illnesses and substance use disorders. Okay. for that person you call it as a psychiatrist. Okay. Next, psychiatry. The term is psychiatry. Psychiatry is a branch of medicine that deals with the science and practice of treating mental, emotional, or behavioral disorders, especially as originating in endogenous causes or resulting from faulty interpersonal relationships. So, what is psychiatry? Psychiatry is a branch of medicine that deals with the science and practice of treating mental, emotional, or behavioral disorders, especially as originating in endogenous causes or resulting from faulty interpersonal relationships. Okay, here we are going to practice about or treating about the mental, emotional, or behavioral disorders, especially as originating endogenous causes or resulting from faulty interpersonal relationships. So these are the terms which are comes in the main terminologies which are we are going to use in the chapter 1. Okay. Now we'll see what is mental health. Take the definition for mental health. Mental health, it is a state between the individual and the surrounding world. It is a state harmony between oneself and others, a coexistence between the realities of the self and that of other people and the environment. This is the meaning for mental health. Next, definition for mental health. According to the Carl Menninger, mental health defines mental health as an adjustment of human being to the world and each other with a maximum of effective and happiness. First definition, according to the Carl Menninger. In 1957, Carl Menninger has given the definition for mental health. According to Carl Menninger, it defines mental health as an adjustment of human being to the world and each other with a maximum of effectiveness, happiness. Here is the describes it is mental health as an adjustment of human being. Here they are going to adjust. Human beings are going to adjust to the world and each other. They are going to adjust with each other with a maximum of effectiveness and happiness. Second definition, according to the American Psychiatric Association, APA, it defines mental health has simultaneous success at working, loving and creating with the capacity for mature and flexible resolution of conflicts between instincts, conscience, important other people and reality. According to American Psychiatric Association, APA, it defines mental health as simultaneous success at working, loving and creating with the capacity for mature and flexible resolution of conflicts between instincts, conscience and important other people activity. Yeah, in simple words we have to tell means, yes, it is an adjustment between the individual and to the world or to the surroundings. Okay. Next, thus the mental health would include not only the absence of diagnostic labels such as schizophrenia and obsessive compulsive disorder, but also the ability to cope with the pressure of daily living, freedom from anxieties, and generally a positive outlook towards life vicissitudes and to cope with those. Take one more definition according to Bhatia and Craig. Craig and Bhatia, first year you studied no in psychology. Craig and Bhatia textbook. Craig and Bhatia authors, psychiatrist, psychologist. Take them according to Craig and Bhatia, CRAIG. Craig and Bhatia, BHATIA. Craig and Bhatia. Mental health is a process of adjustment. Mental health is a process of adjustment when when involves compromise, adoption, growth, and continuity. According to Craig and Bhatia, mental health is a process of adjustment when involves compromise, adoption, growth, and continuity. One more definition you can take.
Sir, growth and
continuity. That adjustment factor, they are going to increase their abilities. They are going to grow. CONTINUITY, continuity. Take one more easy definition. One more definition for mental health. Mental health is a state of balance between the individual and the surrounding world. Harmony between HARMONY, harmony between himself with others, and his environment. So it is a state of balance between the individual and the surrounding world, harmony between himself with others and his environment. Okay. Next we'll see components of mental health. Here we'll see what are the components of mental health. What are the main factors or components of mental health? So if mentally healthy person, what are the abilities or what are the components he is having? Alright. What are the qualities? What are the adjustments he is having? Okay, that is the components of mentally health. Components of mental health. The components of mental health includes first one, the ability to accept self. First one, this is the main important point also. The ability to accept self. That is, a mentally healthy individual feels comfortable about himself. He feels reasonably secure and adequately accepts its shortcoming. In other words, we have to tell means he has self-respect. He has self-respect. Here he is going to accept the realities. A mentally healthy individual feels comfortable about himself. He feels reasonably secure and adequately accept his shortcoming. In other words, he has self-respect. जो रियलिटी के बारे में इसने सेल्फली एक्सेप्टेड करना, सेल्फ रेस्पेक्ट रहना. अगर कोई दूसरे लोग कुछ बात किया, अच्छा बात किया, बुरा बात किया, इसको जज करना, एक्सेप्ट करना. First is the ability to accept self. Next point, next component, the capacity to feel right towards others. The capacity to feel right towards others. That is, it is an individual who enjoys good mental health is able to be sincerely interested in others' welfare. He has friendships that are satisfying and lasting. Is able to feel a part of group without being submerged by it. He takes responsibility for neighbors and his fellow members. So the second component is the capacity to feel right towards others, ready to help to the others, and ready to participate in others works, and ready to help happily. He will think about the society or welfare, or he is going to make a good friends, and satisfyingly he will active with the groups. The capacity to feel right towards others. Third one, the ability to fulfill life's tasks. The ability to fulfill life's tasks. That is, the mentally healthy person is able to think for himself, set reasonable goals, and take his own decisions. See, mentally healthy person is able to think for himself. They'll think about himself, set reasonable goals, and take his own decisions. For example, your people's having some goals. What is that? How to study and clear your exams. Okay, that is your goal. How to do something in your life. How to take your own decisions. And you are going to fulfill that one, goals and own decisions and all. Okay, how to set reasonable goals and make it is reality, and how to take your own decisions, and he does something about the problems as they arise. When problems will come, he is having the ability to solve that one. He shoulders his daily responsibilities and is not bowled over by his own emotions, fear, anger, love, or guilt. Daily has to think about his own responsibilities and is not bowled over by his own emotions, fear, anger, love, or guilt. ये कोई फील्स के बारे में सोच के अपना गोल वगैरह नहीं देना. Next, indicators of mental health. Indicators of mental health. Indicators of mental health. Jawada, a psychiatrist in 1958, has identified 6 indicators of mental health. Jawada in 1958 has identified 6 indicators of mental health, which includes first one, a positive attitude towards self. A positive attitude towards self. Positive attitude towards self. That is, this includes an objective view of self, including knowledge and the acceptance of strengths and limitations. The person has to adopt the positive attitude towards self. Positive attitudes, yes, I can do it, not an issue. I will manage, I will do hard work. Okay, this work is possible from my side, I can do. These are the positive attitudes. They are going to accept their strength and limitations with their knowledges. The individual feels a strong sense of personal identity and security within the environment. The individual feels a strong sense of personal identity and security within the environment. This is the positive attitude towards self. Second one, second indicator, growth, development, and the ability for self-actualization. Growth, development, and the ability for self-actualization. Second indicator, growth, development, and the ability for self-actualization. This indicator correlates with whether the individual successfully achieve the tasks associated with each level of development. The indicator describes, the indicator correlates with whether the individual successfully achieves the task associated with each level of development. Here it shows either the person, whether individual, a person successfully achieves the task associated with to reach level of development. Either they will reach their destiny or not. Okay, here the task will show. Third indicator, integration.
है
Yeah, Mumpy. What about Mumpy? Integration includes the ability to adaptively respond to the environment, the development of a philosophy of life, both of which help the individual maintain anxiety at a management level in response to stressful situation. Third indicator, integration, includes the ability to adaptively respond to the environment and the development of a philosophy of life, both of which help the individual maintain anxiety at a management level in response to stressful situation. Here it is integration shows it includes the ability to adaptively respond to the environment and the development of philosophy of life, both of which help the individual maintain anxiety at a management level in response to stressful situations. Fourth indicator, autonomy. Autonomy, it refers to the individual's ability to perform in independent, self-directed manner. It refers to the individual's ability to perform in an independent, self-directed manner. The individual makes choice and accepts responsibility for the outcomes. It refers to the individual's ability to perform in an independent, self-directed manner. Self-directed manner. The individual makes choice. The individual makes choice and accepts. Make choice and accepts. Make choice and accepts responsibility for the outcomes. Autonomy refers to the individual's ability to perform in an independent, self-directed manner. He has to involve by his own self to perform the activities. He can able to complete the works or tasks. The individual makes choice and accepts responsibilities for the outcomes. He has to he is the responsible person to make the individual choices for the outcomes, for the results. Whatever work he is going to do, for that work's results, he has to be the responsible. Fifth indicator, perception of reality. It includes perception of the environment without distortion, as well as the capacity for empathy and social sensitivity. Okay. Respect and concern for the wants and needs of others. Perception of reality. Perception of reality. It includes, this includes perception of the environment without distortion. Environment without distortion, as well as the capacity for empathy and social sensitivity. As well as the capacity for empathy and social sensitivity. A respect and concern for the wants and needs of others. Wants and needs of others. Sixth indicator, environmental mastery. Environmental mastery. This indicator suggested that the individual has achieved a satisfactory role within the group. Satisfactory role within the group, society or environment. Society or environment is able to love and accept the love of others. So, according to the Jahada in 1958, has identified 6 indicators for mental health, which includes first indicator, a positive attitude towards self. Second indicator, growth, development and the ability for self-actualization. Third indicator, integration. Fourth indicator, autonomy. Fifth indicator, perception of reality. Sixth indicator, environmental mastery. So these are the indicators which are performed by Jahada in 1958. Next topic, we'll move on to the characteristics of a mentally healthy person. Characteristics of a mentally healthy person. Again, I will connect. Okay, be on the line.